Surveillance after breast cancer surgery. A comprehensive guide based on leading oncology recommendations. Welcome to our in-depth discussion on surveillance following breast cancer surgery, guided by the latest recommendations from respected oncology bodies such as the American Society of Clinical Oncology, the National Comprehensive Cancer Network, and the European Society for Medical Oncology. Let us begin by understanding the primary goals of surveillance after breast cancer surgery. These include the early detection of any local or regional recurrence, that is, cancer that may return in the breast, chest wall, or nearby lymph nodes. Surveillance also aims to screen for new cancers in the opposite breast, identify distant metastasis if curative treatment is still a possibility, monitor and manage the long-term effects of cancer treatment such as swelling of the arm, heart health concerns, bone loss, menopausal symptoms, and emotional well-being. Furthermore, ongoing follow-up is crucial for maintaining overall health and providing psychological support, all of which contribute to improved quality of life and survival. It is important to note that, unlike with some other cancers, intensive follow-up with advanced scans or routine blood tests is generally not recommended for patients who do not have symptoms. Large clinical trials have shown that such intensive testing does not lead to better survival rates, and may actually expose patients to unnecessary anxiety and procedures due to false alarms. So, what does a standard surveillance plan look like for a person who has completed their initial treatment for breast cancer? Let us walk through the typical timeline and recommendations. For the first 3 years after treatment, you can expect to meet with your healthcare provider every 3 to 6 months for a thorough history and physical examination. The main focus of these visits is to look for any signs that the cancer might be returning, such as new lumps, changes in the skin, or persistent pain, and to help manage any lingering side effects from treatment, like joint pain or fatigue. From years 4 to 5, these visits become a bit less frequent, happening every 6 to 12 months. After 5 years, they are typically scheduled once a year, and this annual rhythm continues for life. These regular checkups remain the cornerstone of surveillance, offering a chance to discuss any new symptoms, review your overall health, and ensure a comprehensive examination of the surgical area and lymph nodes. Annual imaging is another key element. For those who had breast-conserving surgery, a diagnostic mammogram of the treated breast is recommended each year. If you have only one breast, an annual screening mammogram of the remaining breast is advised. For individuals at particularly high risk, such as those with certain genetic mutations, a strong family history, or dense breast tissue, a yearly magnetic resonance imaging scan may also be suggested, always as an addition to, not a replacement for, the mammogram. In addition to these core steps, some patients will need specialized follow-up. For those taking medications like tamoxifen or tauromorphine, an annual gynecological exam is important to watch for rare but serious side effects such as changes to the lining of the uterus. If your treatment included aromatase inhibitors, your healthcare team will keep a close eye on your bone health, often starting with a bone density scan and repeating it as necessary to prevent osteoporosis. What is not recommended for routine follow-up? If you do not have symptoms, regular blood tests like complete blood counts or liver function tests, tumor marker tests, or advanced imaging such as computed tomography scans, positron emission tomography, or bone scans are not part of standard surveillance. These tests are reserved for situations where there is a specific concern or new symptoms that need investigation. Let us discuss what might trigger further evaluation. If you experience persistent pain, especially in the bones, a new lump in the breast, chest wall, scar, or under the arm, any skin changes such as redness or thickening, a cough or shortness of breath that will not resolve, unexplained weight loss, or neurological symptoms like ongoing headaches or seizures, you should promptly report these to your medical team. These symptoms may lead to additional imaging or diagnostic tests. Some individuals require special considerations. If your initial cancer was advanced, if you have a known genetic mutation, or if you had inflammatory breast cancer, your oncologist may recommend a more individualized and sometimes more intensive follow-up schedule. For those with breast implants or reconstructive surgery, physical examinations and imaging will be adjusted to monitor both the implant and surrounding tissue. Finally, education is a vital piece of the surveillance journey. Patients should be empowered with information about which symptoms to watch for and encouraged to make healthy lifestyle choices, including regular exercise, a balanced diet, and adherence to any recommended endocrine therapy. In summary, Surveillance after breast cancer surgery is a careful, evidence-based partnership between you and your healthcare team. The aim is to detect any issues early, maintain overall health, and improve quality of life, all while avoiding unnecessary tests and anxiety. Thank you for joining us for this comprehensive overview. If you enjoy the content, please like, share and subscribe. It's the Everything Surgery Podcast. Dissect the extraordinary.